Ewan Cameron's presentation. Ewan is the Chief Executive and Founder of Cohesion Medical. For the past 9 years, he's been doing that. I worked with Ewan last year on a virtual trade mission to the Pacific Northwest, where he spoke to an event in Oregon. So he's getting the brand name around the US. So look forward to hearing from Ewan. Now, over to you, Ewan.
Thank you, Alan, and good morning, Chicago, from good afternoon, Scotland. I'm delighted to be here and just to tell you a bit more about what we do as Cohesion. We're a connected citizen health, digital health company based in Glasgow, Scotland, and we've been developing quite the world-leading AI-driven technology for real-time remote monitoring of health conditions. So I'm the CEO and founder of Cohesion. We've been going 8 years now, won some quite large innovation awards in Scotland and the UK, and my background is a bioengineer, systems engineer, as well as an AI and data scientist. So if I could just tell you what no one's telling you about Scotland, it is a wonderful country, beautiful scenery, great culture, lovely history, but actually we've got a bit of a dirty secret, and that is that we are the most ill country in Western Europe. And we have our lowest life expectancy, more drug deaths than per capita than the US, complex needs around our aging population, and very high levels of chronic disease, cancers, obesity, and suicide. And with regards to COVID, we were the third worst country hit in Europe. We were, I think, behind Spain and England. So we have this problem that we don't really like to talk about. Actually, that problem is very much a global problem and a US problem specifically. 7 billion people have health needs. We're all on the same journey from birth to death, but on that journey, we all have to have access, affordable access and inclusive access to health needs. In the US, there's significant problems around healthcare. You'll be aware that obesity levels now are officially at 51% in the US. Scotland's not far behind that. So there is this huge demand, not just in Scotland, in the US, but globally for a better health system. But actually, the systems we currently have are not actually serving that purpose. There's hundreds of thousands of single condition apps that are rarely used more than once. There's large electronic patient records that are not interoperable, very easy to put data in, but very difficult to get data out. And the pandemic with COVID has exposed some of the issues around that. So getting access to analytics in real time of real world data is a real big problem for health systems across the world. Our approach to that is to look at a much more connected whole life health story. We've developed technology around our Citizen Health Wallet to create a whole life record for multi-conditions, multi-services, and multi-users. A cloud services platform that's configurable to different types of healthcare, different specialties and ologies, as well as social care, community care, post-diagnostic care, as well as a means to kind of like analyze the data that's now being communicated between the citizen and the service to make life sciences more innovative. And the solutions we've been developing have had very positive adoption by patients, 96% net promoter score and satisfaction. The services platform that we've demonstrated in the US and specifically in the Midwest has actually been seen as a bit of a game changer in affordability. And in terms of like, you know, the power element of the data that's being captured, we've had meetings with Google Verily, who or individuals within Google Verily who've kind of recognized that we're actually forging ahead with new models around population health and disease that play with the whole precision medicine agenda. So what does this look like? Well, Cohesion OS is our connected health system. It's predicated on our Citizen Health Wallet, which connects with our Codex Open Data Exchange. And off this, we've got a range of platforms that we've developed that are now successfully operating in Scotland, And just this week, we've now been commissioned for a large-scale deployment in NHS England. That's England's National Health Service. So that's covering healthcare, different types of conditions, from inflammatory diseases and IBD, rheumatology, dermatology, right through to cancer and mental health, through to our community pharmacy. We've undergoing a piece of work with community pharmacy in Scotland across 1,400 retail pharmacists. And we're working with some of our national charities who are providing post-diagnostic support for dementia care and cancer care. Because we've taken this open data exchange and interoperable approach, it's allowed us also to connect not just with home sensors, but like smart devices such as oximeters, glucometers, trackers, as well as blood pressure monitors. And we've got a library of APIs and apps which are now plugging into this. So we can work with existing EPR systems, your Epics, Cerners, Allscripts. We can work with legacy systems that are and statutory systems. We've just been commissioned a piece of work in England around connecting some UK government systems that no one else has. So it's a bit of a big breakthrough moment for us. But that integratability is actually one of our key strengths, which is why I think what's cool about us and what makes us different. Well, interoperability is really, really important. That ability to take data blocks and bricks, rearrange them in different configurations, is a bit like Lego. It's a bit like taking small pieces of data and reassembling them in different configurations for different purposes. But it's also about early detection. We have developed a proprietary CDR system, which is on condition early detection and risk, which allows us quite deep insight into behavioral analytics, allowing us to predict early detection of frailty right through to inflammation. And the photograph aside that is Robert Watson-Watt, not one of our most well-known Scottish heroes, but actually this individual invented radar. And radar and our CDR are very much the same. It's that notion that we can detect things earlier in advance before, in radar's case, like an attack happens, or in our case, like an inflammation or a condition change occurs. So it's quite interesting. And although this was just in Scotland, we actually see this applicability of rheumatoid arthritis work also being relevant to multiple stakeholders, including healthcare providers, payers, employers, community pharmacy, as well as life science companies like AbbVie, as well as technology partners who are interested in connecting this together. So in terms of other applications, we've covered a whole trajectory of cradle to grave conditions, covering from mental health, cancer, inflammatory, as well as respiratory, diabetes, dementias, and end of life. And we've got projects happening in Scotland as well as England now that cover these conditions, but also these operational processes. In terms of our interest in Chicago and Illinois, although I haven't highlighted it, I have been in Chicago quite often prior to COVID. It's given me an opportunity to really explore the Midwest, and it actually allowed me some insight into realizing that there are 40 states that are roughly the same size of Scotland in terms of population, but also have the same shared health challenges. And again, prior to COVID, I was asked to speak in Indiana as part of how to disrupt health with big data. It's been really good that Bloomberg has recognised that we are quite a hot property in the UK, and we were the strongest digital health player at Mobile World Congress a couple of years ago now. In terms of our team, we're small but perfectly formed. I'm probably the least well formed of my team, but we are effectively very bright engineers. With my colleague Emily's here with us today. She's got a life science background in immunology, but effectively we are very much a technical development team. We are looking for opportunities with Chicago where we can engage to do work with some of your healthcare providers, payers, and health community, life science community. I think we could bring something rich and valuable to your ecosystem. And we've won a whole range of awards, including what's most important to me, Scotland Employer of the Year in 2018, which was one of our highlights. And that sums us up. If you'd like to be in touch to know more, here are my contact details. I look forward to talking to you afterwards. Thank you. Back to you, Alan.
Thank you, Ewan. And that's the word of the day: interoperability. There we go. It's a word we've learned. An interesting fact about Scotland, which was relevant to Mary and IP, was that the first Scot who invented the bicycle actually didn't patent it, so he lost out to another Scot who had the sense to patent it 20 years later in the 19th century. But if I could ask Mary, Wendy, and Ewan to come back on the call, then we could perhaps have a brief panel session. Yeah. And Ewan, I guess you must face similar challenges. What differentiates you to the digital health providers that are already the other side of the pond from ourselves today?
I think as a Scottish company going to the US, I think it's been great to have the kind of recognition that engineers are liked. Scotland has a history of great engineering. I think America actually appreciates engineers, which is good. I think they also appreciate value opportunities, which is also good. And I think the level of ambition in the US is really the most exciting part. Whenever you meet, even with people that could be a competitor, they are always looking for a partner opportunity. And that notion of rather than kicking each other as a competitor, you can be stronger as a partner and look for wider opportunities. I think that's been the greatest surprise for me, is that kind of openness to engage and say, let's work together on something bigger. And I think in the digital health community, and specifically in Chicago, but also in the wider Midwest, there is really an appetite for doing big things, and that's great to have that kind of welcome, which you don't quite get in the East Coast or the West Coast, which is why I quite like Chicago.
Ewan, how has the pandemic impacted upon your business? Has it created opportunities for you in amidst all the challenges and strife?
Yeah, I think COVID as a pandemic, it has affected everyone globally. I think it has led to the world's health systems, whether they be private care or state care, waking up to the fact that they need to be a bit more resilient in terms of how they deliver their services, and also those services can be delivered in a much more remote way, and ideally in a real-time way. So it's kind of, as you say, it's been a terrible time for everyone in the world. It's been difficult for UK as much as the US. I think it's created a paradigm shift in healthcare, that they now are moving towards rethinking the delivery, the monitoring, the types of therapies and services that are delivered. And that has been quite a big opportunity for us, because we've been arguing that case for several years, that there's a need for change. And I think COVID's actually been has lit that fire to say, we need to do things differently. And whether they're existing players, smaller health providers, insurers, or tech companies, or life science companies, everyone has now had a bit of a jolt and is now looking at how to do things differently. And I said that's opened up huge numbers of conversations for us with some very important US organizations. So there is a bit of a light at the end of the tunnel for us.